Getting mobility right is absolutely crucial for child health. So the FIA Foundation, together with a range of partners, is establishing this new global initiative for child health and mobility, which is focusing very much on what can we do to improve the quality of life and the journey to school and the journey around town for children.
We have stakeholders from across the continent. All the important players are here today, from the private sector, from the NGO world, from government, from the traffic police.
There is one reason why we have been brought together: to combat a crisis that continues to be ignored, and one that threatens the day-to-day lives of our children.
The target on reducing road traffic injuries is something that is in the hands of all of us.
There's a very strong reason for focusing on children, in my view, which is why I'm delighted with the focus for this initiative. There's no point governments pitching up once every few years to New York and signing up for ambitious goals, or putting their name on the Convention for the Rights of the Child, and then turning a blind eye to a solvable problem that is killing over 500,000 children every single year. That is just flat wrong, and we have a responsibility to hold governments to account for what they sign up to.
My job today is to put a human face on the problem that brings us here today. So let me start by telling you about Ibrahim, an 8-year-old boy who, very vibrant, eager at life, helps dad after school every day. And so presents to my ED 2 weeks ago, only 45 minutes after arriving. Ibrahim was dead. Another child pronounced death in our ED. I can't get them out of my mind. Life cut short just before it started. I can't get the kids out of my mind. And I tell you today, there are many more Ibrahims out there, many, many more kids. Kids knocked down en route to school or while coming back from school.
What we need to do now is get the arguments turned into action. And what we've done here in Accra this week is we've brought together policymakers, stakeholders from across the community to try and begin to build a coalition for safe and healthy journeys to school. We're outside the school in Accra, where we've put in place footpaths and speed humps to reduce the vehicle speed. If we can do this, it's the beginning of a safe system. It means the traffic has to slow down, it means children can be safer, we can reduce preventable injuries. It's an agenda that makes sense, it's an agenda that governments have signed up to in the Sustainable Development Goals and in the Habitat 3 New Urban Agenda. Now we want to see it put into action.
When we're having an event like we're having here in Accra, the point is to pull policymakers and powerful individuals from government together and demonstrate things that actually work, and then say to them, look, if an NGO can do this, if we can do this, you can too. This is something that incontrovertibly works to save lives on the roads today.
This is the AMEND team. We're a team of engineers who do the assessments around our schools to determine where the danger spots are for children. And from that we come up with our maps and layouts which show the countermeasures which we have identified to help improve safety along this stretch of road. One of the most important things we do is to speak to the children themselves and listen to them, because they know the points which they find the most dangerous.
So we've completed a 2-year impact evaluation, a population-based control study to measure the impact of our infrastructure program around schools. And we found an over 25% reduction in the number of road traffic injuries. For every 286 children whose school receives these improvements, 1 injury will be prevented per year. This isn't just us saying it. We did a study, gold standard study with the Centers for Disease Control in the US. This is the way drugs are tested, and this is the first road safety intervention in sub-Saharan Africa to be proven to save lives. We have the proof, it works. Now the only question is, can we build the political will to scale this up?